Welcome back to Your California Life. We have new findings that show potential advances in the fight against non-small cell lung cancer. Joining us with more on this is Dr. Roy Herbst. Am I saying your name right, Dr. Herbst? Perfect. He's with the Yale Cancer Center and Smilow Cancer Hospital. Thank you so much for joining us. But we got to start off. I talk for a living, but I barely know what non-small cell lung cancer is. What is that and how prevalent is it?
Well, lung cancer is the #1 cause of cancer death worldwide, as it is in the United States, over 200,000 cases. And non-small cell lung cancer is about 85% of those cases. So it's quite prevalent, one of the most common cancers. And about 15 to 20% of these cancers have a disorder, an epidermal growth factor receptor, which is a target of the therapy we're talking about today.
Okay. So what? Oh, it looks like we lost his audio. Can you hear me, Dr. Herbst?
I can.
Perfect. Okay, so let's talk about the new data that was released surrounding non-small cell lung cancer medical advances.
Well, we actually had a trial called ADORA in partnership with AstraZeneca. We presented at the big society meeting, the American Society of Clinical Oncology, a few weeks ago. And in this trial, we took lung cancers that had been removed, and that's about 30% of lung cancers. And once removed, there's still about a 50 to 70% chance it will come back. So what we did is in this trial, we gave those patients standard therapy, and then we randomized them to a new targeted drug that targets epidermal growth factor receptor or a placebo. 800 patients, worldwide trial, US, Asia, Europe, really 4 continents. And what we actually found is that there was an 83% decrease in recurrence in those patients who got the study drug. Now, I've been doing lung cancer a long time. That was an amazing result. We knew that the drug was active. We knew it was well tolerated. But this speaks to the fact that when you take this additional therapy, a pill, you can reduce the risk of the recurrence in the lung, in the vital organs, in the brain. So a really important result for patients, because it brings a new paradigm to how we're going to treat this disease with new targeted therapies in earlier settings.
Wow, that's incredible. So how significant are these investigational findings for patients with early stage disease, in particular in the lung cancer community?
This is practice-changing data. Physicians and patients alike all were quite excited about the numbers, the fact that there was such an improvement, and this will lead to testing patients earlier for these abnormalities and using these precision-guided drugs, the right drug for the right patient at the right time, to extend survival with less recurrence, better quality of life. So it's really very important for patients.
Okay, so let's talk about this. How does this scientific development change the landscape for treating certain patients with non-small cell lung cancer?
Well, it's a new paradigm. Traditionally, we've only used these drugs in the most advanced setting when the cancer's already spread. And we improve survival there, but frankly, we don't really cure very many. But by using these drugs earlier on, when there are fewer cancer cells, in fact, we don't even see any cancer, but we're still using these drugs because we know that some cancer must exist. We can kill more cancer. We can help patients live longer. These drugs are well tolerated. So this is going to be something new for this drug, but also for other therapies that target abnormalities in tumors. And I predict that we're going to start testing patients early on. At the time of the surgery, the oncologist and the surgeon and the pathologist will get together and they'll pick the best therapy to use in this adjuvant setting after surgery to allow patients to live longer with less disease. So it really is the next chapter in how we're treating this very deadly disease.
Oh, that is promising news. Where can patients go for more information and support?
Well, there's a website, lvng.com, Living with Lung Cancer, and certainly you could go to the Yale Cancer Center site as well, and many other sites to find information on lung cancer.
All right. I appreciate you for joining us, Dr. Rob Herbst. Thank you.
This interview involves commercial content. The products and services featured appear as paid advertising.